Today I'm gonna answer the question, do we really need omega-3? Hi and welcome to my channel, Kristina B1. I am Kristina and I work as a naturopath. And today I'm gonna talk more about fatty acid omega-3. Omega-3 is an essential fatty acid, and that means that the body cannot produce it itself, so we do need it to get it from food we eat or from supplements. And we do get the omega-3 fatty acids from wild caught fish, fat fish mainly, and we also get it from grass-fed beef. The food we eat with fruit and vegetables don't contain as much vitamins and minerals like they used to do. Studies has also shown that the fish doesn't contain as much omega-3 today that it used to do. So I suggest that to find a good supplement to make sure you get enough of the omega-3 fatty acid. We have another essential fatty acid, and that is omega-6. So they're both essential to the body. Omega-3 can lower inflammation in the body, while omega-6 is the one that helps to create inflammation, which is also, of course, important when it is needed. The thing is, though, omega-6 we definitely get enough from our diet. Fast food or processed food is very, very high in omega-6. Also margarine and most vegetables oil like canola oil, sunflower oil, etc. Also bread and grains, you get lots of omega-3, omega-6 and also from nuts and seeds. So the ratio between omega-3 and omega-6 should be 1:1. But today most people might have a ratio 1:10 or even 1:20 or higher. So omega-6 we do get enough. So if you want to take a supplement of a fatty acid, it is omega-3 we need. And especially if you have an inflammation in the body, because that is your body telling you that you need more omega-3 to lower that inflammation if it keeps on going. So we have 3 different types of omega-3 fatty acids. That's ALA, EPA, and DHA. The ALA, the first one, is the one we get from vegetable sources like flaxseed oil or walnuts. But that has a very limited value for our body and for our health. And a very small amount of the ALA can be converted into the longer fatty acid chains like EPA and DHA. So all the good benefits I'm going to talk about omega-3, that comes from the long fatty acid chains, EPA and DHA. And those we get from the fat fish, for example, and we also get it from the algae. So I think it's a very good idea to get good omega-3 fats from algae and make sure it's an algae that can produce the long fatty acid chains. It's actually the fish eating the algae that is making fish rich in omega-3. So here we have the flower of life. It symbols cells in this case. And I just wanted to show the outer layer of the cell is called the cell membrane. And that is very rich in omega-3 fatty acid. To protect our cells in our body, we do need enough omega-3 that gives a good protection to all the cells in our body, everywhere. I already mentioned it's important to reduce inflammation. So if you have an ongoing inflammation in the body, it's good to increase the dose of omega-3. You can have inflammation in your intestine, in your brain, in your joints, and all the different internal organs. So wherever the inflammation is, you can get an extra help to reduce inflammation if you have enough omega-3. Also, omega-3 is very important for our brain. Our brain cells contains even more fat than other cells. So to keep a good memory, to have clear thoughts, to keep the cognitive function, to reduce the risk of getting dementia or Alzheimer, it's a good idea to get enough of the omega-3 fats to protect our brain. It's also very important for our heart health, to reduce inflammation in the heart, but it's also important to clear the arteries of plaque, build-up of plaque. Omega-3 can lower the bad cholesterol, increase the good cholesterol. It can lower the triglycerides, and therefore also can help to balance a high blood pressure if you have enough omega-3. So very important for the health of our heart. It's also very important for the eye health. So these are the three main organs that are very dependent on enough omega-3: the brain, the heart, and the eyes, to keep a good vision, to keep a healthy macula in the back of our eye, but even to keep a healthy pressure in our eye, we need enough omega-3. It's also very important for our mental health, to reduce the risk of getting bipolar disease or depression, anxiety, fatigue, because omega-3 is so important for the brain, for the nerves, and for the neurotransmitters. It's also important for the skin health. The skin is the largest organ of our body, and that needs enough oil to have a protective layer, so you don't get a dry, scaly skin. So have a healthy, glowing skin, we also need enough omega-3. It can even reduce the effect of acne, eczema, etc. Also for a healthy liver, it can reduce the risk of getting a fatty liver. So instead of having the bad fat, we need the good fats to balance and have a strong, healthy liver. So all in all, it's very important to keep a strong and healthy immune system and not have too much inflammation in the body. We do need enough of this important essential fatty acid. Many studies also show that it's very important for ADHD and ADD. So because it can help to increase the span of concentration and focus, and lower the effect of, if you're very hyperactive, it have a very calming effect on you. So it's very worthwhile trying extra omega-3 if you're suffering from any of these symptoms. So how is the body telling us that we're not getting enough omega-3? I'm going to tell you some of the deficiency symptoms that you can get if you don't have enough. Inflammation in the body, anywhere in the body. Cracking of the joints. If every time you move your joints and it's cracking, it's your body's way of telling that you're lacking lubrication in the joints, and that can also lead to, of course, pain and inflammation in the joints. So even for the joints, it's very important to have enough omega-3. It can also cause memory loss, since it's so important for the brain. So if you feel you're not as sharp as you usually used to be, try to increase omega-3 and see what happens. It's a very easy way to find out yourself. Also to balance a high blood pressure or a high cholesterol. Body also telling why you might get an eye disease, or you get blurred vision, or you get dry eyes. Try extra omega-3. If you suffer from depression, anxiety, fatigue, or if you have a dry, scaly skin, or even bumps on the skin. It can look like when you get goosebumps, but it stays all the time. That's also a signal that your body is telling you that you need extra omega-3. Deficiency symptoms can also be asthma or worsening asthma, allergies, eczema. And a low immune system, when you get a cold that it doesn't really go away, or you get it over and over again. You need to find ways to strengthen your immune system, and omega-3 is one of those nutrients that you need, or one of the important fatty acids that our body needs. So on the question, do we really need omega-3? The answer is, of course, very much yes. Yes, we do need omega-3. It's very important for the health of our body, for the health of our skin, to lower inflammation, to have a healthy brain, healthy heart, healthy eyes. I have tried many supplements of omega-3 and always had this uncomfortable feeling of burping fish oil the whole day, which ended up that the capsules was just staying unused and then going rancid. You know, it's very important to use within the best before date so they don't go rancid. So it just didn't do anything for my health and got very expensive when it just stayed in the fridge. But today I found a really good supplement made from algae. I love the clean, pure source. I know it's very safe and it has a good taste and it makes me feel better. So if you're curious to find out which omega-3 I'm using, I will put a link below in the comment section. But just remember, omega-3 is very important, and eat fat. Fish several times a week. That's also, of course, a good source to get extra omega-3. So I hope this was useful. Thank you for watching to the end of the video. Stay healthy, and I'll see you in the next video. Bye for now.